The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you. Thanks for stopping in and listening to the next episode of TMD Demystified. I am Tony Urbanic. Today, the topic for discussion is why TMD is a confusing disease. Why is it a confusing disease? Does anyone out there disagree with the fact that it is a confusing disease? I would think that no one who has anything to do or any experience at all with TMD would not classify it as a confusing disease. Today, we're going to unpack that a little bit, discuss a little bit as to why it is so confusing, hopefully at least leading in the direction of making it a lot less confusing, because just to talk about the problem isn't going to get us anywhere. But first, we have to define, clarify, classify, if you will, the problem itself. So in my experience, which goes back admittedly quite a while, just look at my white hair to validate that. TMD goes back, in my world, back into the early 70s. Excuse me. At which point it was a confusing disease then, as it is a confusing disease now. I literally, just about an hour ago, got off of a Zoom virtual meeting with, I think it was 9 other general dentists from a DSO who really didn't even know enough about TMD to ask appropriate questions. I made a presentation. I explained several things, mostly to generate interest, mostly to generate some considerations or especially some questions. And it was obvious that there wasn't enough knowledge out there to even generate questions. And I could see the look on some of their faces is basically total confusion. What I was talking about was, totally out of their wheelhouse. And that isn't the way it should be if you are a doctor of dentistry, and dentistry, fortunately or unfortunately, has the responsibility now of dealing with, treating this conundrum that we call TMD. I've spoken on why that happened. I may mention it again, but so we need to discuss in a concise way why TMD is a confusing disease. So there's 5 major portions that I picked out. There may be others, and I encourage anyone else that would like to add to this list or comment on the list or even criticize the list, especially criticize the list if you want to be critical. I'm open for criticism. I'm open for critical comment. To clarify these issues in front of the profession, in front of my colleagues, in front of my dental friends. So, first of all, it's a confusing disease because of the disparate symptoms. And a lot can be said about that, but the well-known, well-established symptoms of TMJ-TMD are frequent or recurring, severe, sometimes, debilitating, often, headaches, frequent or recurring earaches, pain that radiates down the back of the neck, side of the neck, or forward into the jaw, mandible. Tinnitus, ringing in the ear, fullness in the ear, subjective hearing loss, various kinds of dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of locking, inability to open the mouth or even close the mouth completely, which would be a variant of locking of various kinds. I've talked about each of those many, many times on other episodes, but the point is those are very disparate symptoms. And the medical establishment, the medical doctors, physician's assistants, nurse practitioners, who are confronted by a combination of these symptoms presented by a patient coming to see them under whatever circumstances, say this makes no sense. And to the medical doctors, it doesn't make any sense. They are very used to going through, the series of possibilities based on the symptoms themselves, running a symptom list and looking at what are the possibilities based on those symptoms or symptom. But when a patient comes in and says, I have headaches every morning, and some mornings it's here and some mornings it's here, along with my shoulder pain and arm, hand, finger tingling and numbness, the physician is just going to roll her eyes and say, this doesn't make any sense to me. That's because the symptoms are so disparate. Of course, if you know what the common denominator is that can create each and every one of those symptoms directly, then it seems to be very easy. And that's one of the main reasons I do these episodes, is to bring out the simplicity of this. And of course, you have to define the problem at first. So these vastly disparate symptoms of headache and neck pain. Sometimes patients complain, they say, my jaw pain feels like a toothache. And they end up going to the dentist, and the dentist does his usual examination, x-ray examination. So I cannot find anything wrong with this tooth or this teeth in the area. This happens consistently around here. And consistently, I see patients who have talked some dentist into taking out a tooth or two, even though the tooth was normal and the patient was warned the tooth is normal. And the patient says, no, it hurts right there. It has to be the tooth. Take it out. And some dentists will agree to that, which is frankly inappropriate, but they do, because we see the patients all the time come in with some missing posterior teeth. So the disparate symptoms make this a very, very confusing disease for the physicians, for the dentist, certainly for the patients, because when I say it's confusing disease, it goes all around. For the dentist, for the physicians, for the other professionals, nurse practitioners, and especially for the patients. Because when they do Dr. Google and they Google some of these symptoms, the potential causes of some of these symptoms come up a long, long way from TMD. If TMD is mentioned at all, is at the bottom of the list, and usually it's not mentioned at all. So talk about confusion. The second major point as to why it is a confusing disease is that it has turned out over the decades that only treating the symptoms has been attempted. So again, the symptoms of headache, earache, jaw pain, I won't go through the litany again, but whether it be a single symptom or multiple symptoms, the dental profession and the medical profession jumps on the symptom and does whatever the most likely treatment to decrease, diminish, or ameliorate that symptom is done. And of course, a good, thorough history and examination is usually not done, and a lot of these other symptoms are overlooked. And so the patient is seen and only treated one symptom at a time, or maybe two symptoms at a time, but they're only being treated, the symptoms are only being treated, not the cause. The cause is being ignored. So if you only treat symptoms, and it's only going to be temporary, it's symptoms, and the symptoms move around on TMD, they move all over the place. It's not going to get you very far. So you can treat symptoms. You can treat symptoms with drugs, and a whole long litany of drugs can be used to treat a symptom anywhere on the body. You won't run out of drugs. Surgery, like I am very familiar with. For example, if the patient couldn't open their mouth, that was the symptom, and we knew by MRI examination that the disc, the meniscus, was literally blocking the condyle from its full motion, then obviously the surgeon was going to treat that symptom of inability to open by removing the disc or plicating the disc, trying to put the disc back in the proper position, which is a losing cause. More often than not, just removing the disc, but ignoring the other symptoms that may be involved, because removing the disc isn't going to help the headaches or the shoulder pain. It's just going to get the patient open further, possibly, sometimes not possibly, depending on the surgeon, the surgical technique. But you're still only treating the symptoms. And then, the physical treatments like physical therapy or dry needling are often used, but again, very temporary. Massage therapy, very temporary. A heat therapy, cold therapy, whatever, very, very temporary. And you're only treating the symptoms. So the third reason why this is a confusing disease is that the experts themselves are confused. Excuse me. Now we have a new specialty that has been approved by the ADA, and I believe it's called oral facial pain specialist, OFP maybe, but pain specialist, oral cavity and facial pain specialists. As I understand, there are only 500 of those in the country, but by my observation and watching this group form up, it formed up over the last 30 years. They claim to be the experts on facial pain. Well, number one, again, I back up what I say. The experts, I find, spend a lot of time gaming the insurance companies. That seems to be their major effort, is to game insurance companies so that they can game medical insurance companies to pay for what is truly a medical problem. If you have an elbow problem or a knee problem, a joint problem, a hip problem, it certainly falls into a medical problem. Treating this joint is not a dental problem. It is a medical problem. Of course, the medical insurance companies don't want anything to do with covering this joint and use all kind of various excuses why they shouldn't. But what I have seen, and I know that anyone else out there who's in this area will see it for yourselves, the so-called experts even have courses on how to game the medical insurance companies to pay for whatever treatments that they deem appropriate, really all having to do with treating symptoms. Secondly, the experts in the dental school arena, and there are groups of TMD, so-called experts in the dental school arena who claim expertise. They really spend a lot of their time padding, P-A-D-D-I-N-G, padding the other services in the hospital or medical community to spread out everyone possible that could treat this thing. The psychologist, a psychiatrist, the physical therapist, again, all treating symptoms. For example, psychologists treating anxiety. Well, we admit, absolutely, anxiety causes bruxism. We don't know how. We don't know the mechanism. We can't spell out the series of events that you have anxiety, which causes you to brux your teeth. We know it's in the central nervous system someplace, that's for sure. But to spell it out, we don't know. But to treat the symptom of anxiety, you're just treating a symptom, not the cause. So, and the dental schools, and there aren't many that do it, there are just a few that I am aware of that claim specificity and expertise in treating TMD by bringing as many other, quote, practitioners into the party as they possibly can find. And my opinion, watching that, is the purpose is to enlarge the participation, both factual, manual, and financial, into treating symptoms of patients who have TMD. The experts want to make this as complicated as possible, because if you make your treatment or your explanation or the treatment of the complicated explanation as complicated as possible, it makes it more valuable. It makes the treatment more valuable, or treatments, plural, and it makes the treator, the provider, more valuable. So you can immediately then, if you make it really complicated, then you can make it more valuable. And the experts, by my observation, don't apply basic sciences. They don't apply the basic sciences. And I think that most hopefully you would agree that the solution to most of our medical problems is derived via the basic sciences, not clinical expertise or clinical experience. It's not, you may start out with clinical experience or make clinical observations, but to get somewhere seriously and to get something done that actually explains what is going on as far as the disease, you have to drop back, either start out at or drop back to the basic sciences: anatomy, cell biology, histology, physiology, are basic sciences, which are factual, very factual, and very well studied, and put it together from the basic sciences. And the, quote, TMD experts out there ignore, for the most part, applying basic sciences. So the fourth reason is that the dental profession itself has thrown up its hands on the responsibility of this. It's one of the reasons it's so confusing, because the patients themselves don't know even where to go. They have these symptoms, and whether it's if they think it's a tooth, they will go to the dentist. If they have a headache, they're going to go to their medical doctor. Their medical doctor has no experience. It's not even on his anywhere near the top of the list on his differential diagnosis of headaches, almost exclusively, except around here in Middle Tennessee. And we have a much larger group of medical doctors, PCPs, neurologists, ENT doctors, nurse practitioners, physicians' assistants, who think that it may be TMD if a patient presents with bad recurring headaches. But that is not how it is in the rest of the world. And for the most part, the medical professionals don't think TMD for a patient who has recurrent bad headaches. They go elsewhere. The patient doesn't know where to start out. Sometimes whatever their symptoms are, whatever their problem are, a lot of times they don't even know where to start. And then they end up in the wrong place. The physicians have no knowledge about TMD and don't want to know anything about TMD. And the only thing they say if they suspect it is go see their dentist, and the dentist don't want anything to do with it. Talk about a confusing situation. I mean, it couldn't be a good example of a different confusing situation than TMD as it has played out, as patients and doctors try to scramble to make sense of the symptoms themselves and who should see them without going around in circles indefinitely. And of course, I have seen, and my colleagues have seen who do this, patients who literally spend a long time, 5 years, 10 years, 20 years, 30 years, 40 years, I am not without a lot of examples on ladies in their 70s or 60s or even 80s who claim they have had what obviously have been TMD symptoms for 40 or 50 years. I have several 40 and 50-year-old validated patients who have dealt with this for 40 or 50 years and not even known it was TMD. It's been diagnosed as something else. Of course, it didn't get better. It only got worse. Can you imagine having chronic pain, chronic symptoms of one kind or another, and you deal with it? You have, what are your choices? You got to deal with it, but without resolution for that long. So that is the fourth reason that TMD is a confusing disease. And the fifth is what I touched on before, and that is the fundamentals of disease itself. And I say disease in a general way, but when it applies to TMD, the fundamentals have been ignored. Now, what are the fundamentals of this? The fundamental of TMD is that inflammation drives all the symptoms. I've discussed that. It's on many other episodes. But the fundamental is that inflammation drives all the symptoms. Now, if you look at it from experience and you look at it from practicality, everyone knows that if the diagnosis is correct and has been made, that a non-steroidal and inflammatory will work very well on the symptoms of TMD, but only for a short period of time. That is a fact. And, you know, when I discuss this, when I lecture on it, everyone nods and shakes their head. Yes, we know non-steroidals work very well on TMD, but only for a short period of time. Well, wouldn't that open up a discussion about looking into inflammation and the variants of inflammation and the cell biology of inflammation and the structure of inflammation and how inflammation works, the pathophysiology of inflammation, when it comes to discovering the proper solution for TMD. So if nonsteroidals work really well for a short period of time, how about finding something that decreases inflammation for a long period of time? I mean, that it's self-evident. Structure is clear. But unfortunately, that has not been done, even though sometimes, in my case, I brought it to the attention. I brought that to the attention specifically to the National Academy of Science, Engineering, and Medicine 4 years ago. Please look at inflammation as the common denominator, as the common cause of all of the symptoms. Please. It's on video. It's duplicated. It's issued somewhere within my prior episodes. And even the NIDCR, National Institute of Dental and Craniofacial Research, has grants available to do studies, both academic and clinical studies for TMD, but none of the studies are geared toward really the cause, which is inflammation. I've read the titles of some of the studies that are available, and that isn't the direction they're going. So what I discovered was quite simple, quite unique, and I can't figure out how you can argue with it, that inflammation drives all the symptoms. I explained that, and how tennis elbow and TMD are the same disease driven by the autonomic nervous system. But the inflammation must be addressed directly if you decrease inflammation. And as it turns out, if you unload a joint, hip, elbow, knee, if you have a bad joint and you unload the source of pressure or load on the joint, the inflammation will diminish. When the inflammation diminishes, the symptoms diminish. So why not address the cause? Why not study the cause? Why not figure out maybe there's a better way to decrease inflammation than just unloading a joint. We know that non-steroidal anti-inflammatories work well for a short period of time. We know unloading the temporomandibular joint by separating the posterior teeth according to protocol. There's a protocol necessary because you can't separate the back teeth forever, because you can get super eruption, but not in the protocol that is prescribed, which is 2 months, 24/7, nighttime only, the rest of the patient's life. For adults, a little different in children or adolescents, but for adults, you will not get super eruption of the posterior teeth by separating the posterior teeth for 2 months, because you're going to spend some of that time chewing. It's like posterior disocclusion of the posterior teeth, except when you eat. So 2 or 3 times a day for most people, you're going to eat, maybe more often, but you're going to spend at least 20 minutes to 2 hours chewing food. At which point you're not going to get super eruption of the posterior teeth for 2 months, which gets the inflammation on the way down, on the slope going down. And then once you get the slope down far enough, then most often wearing the device, disoccluding the posterior teeth only 8 hours a day, or the hours that you sleep, is enough to keep the inflammation at bay, just like a non-steroidal would keep the inflammation at bay, except there's no drugs involved. So those are 5 of the reasons why TMD is such a confusing disease. Partially by design, in some cases by design, in some cases by ignorance, in some cases because of kind of lackadaisical interest in solving the problem, because there are other things in dentistry that seem more important, like dental implants and all-on-4. But that doesn't give you an excuse for not addressing it if you're a professional. And if you don't want to do it, this isn't for everyone. I don't claim that every dentist in the country should be doing this. In fact, just the opposite. There are lots of dentists who should not be treating TMD, because it takes not a whole lot of skill. It takes interest. It takes interest in your fellow man. It takes interest in your patients, to see them through, getting them through the protocol, doing the education necessary to educate them as to exactly why they need to do the protocol, exactly how it works, exactly what I just explained to you. And if you are a doctor who's willing to do that for the patient's best interest, then yes, you should be doing this. And the benefits are great. The remuneration is great. The times that the patient says, "Thank you, you just saved my life. Thank you. My life was a mess, and now I feel like I can live a normal life now," or a lot of other things. I just had a wonderful experience. I had one of our network providers, other doctors who use the Urbanic device and protocol, send me a thank you letter. This is a patient of a different doctor who thanked me for doing what we do here. I won't read it to you, but it really was touching. And so I will leave it at that for you, the professional, to think about and to know why TMD has been confusing, and the fact that it does not have to be confusing if you start out with the very simple concept that inflammation drives all the symptoms. And from that, it all comes into view. It all becomes quite simple, and the treatment becomes quite simple and easy to understand, easy to administer, easy to predict. If you'd like to know more, there is more. There's a whole lot of information. We have an online course that teaches doctors how to become providers for the device and protocol. We now have an online seminar available, which will be April 19th, 2024, here in Nashville, Tennessee, actually Franklin, Tennessee. Civil War town, beautiful, beautiful Civil War town. Everyone, at least around here, knows about Franklin. And it is a all-day seminar, 8 to 5, 6 CME credits given. And I promise you, you will know everything you need to know about TMD if you avail yourself of that seminar. You can get onto that seminar through our website, www.urbanictmj.com. You're always welcome to contact me with questions, comments, or criticisms at tony@tmjservices.net. Our Director of Education and Marketing, Dr. Naomi Williams, can always be reached if there's any questions about the seminar, our online virtual course, or if you just like to get in communication, she can be reached at naomi@tmjservices.net. With that being said, I invite you to the next episode, which will occur in 1 week. I think I have a topic picked out. I think it's a very interesting topic. I think we're going to make some very interesting comments about this problem, TMD, as it applies to a medical problem, another medical problem that is poorly understood, but the problem is that this medical problem actually creates TMD. So I have to walk back a comment I made. It may be that there are actually 4 causes rather than 3 of inflammation within the temporomandibular joint, depending on how you structure it. But we'll talk about that next episode, and I'll enlighten you on that. With that being said, I look forward to our next episode. I am Tony Urbanic, and this is TMD Demystified.